Welcome to our deep dive on a recent study about IVDD in cats. You sent us a research article from the October 2024 American Journal of Veterinary Research.
Yes.
And we're going to be talking all about it today.
Yeah.
So we're diving into how common and how bad IVDD is in the spines of cats of different ages. And get this, these cats didn't have any symptoms.
Oh, wow.
We're going to explore things like the location of the spine, the age, sex, or if the cat's been spayed or neutered, plays a role in feline IVDD.
This is a fascinating area of study, especially because we see so many dogs with disc problems.
Right.
So this research in particular looked at 60 cat cadavers.
Okay.
And they were divided into 3 age groups, young, middle-aged, and old.
Okay.
They used MRI and this thing called the modified Pfirrmann grading system to assess IVDD.
And what is the Pfirrmann grading system?
Basically, it's a way to look at the MRI images of the discs and give them a grade based on how much degeneration we see.
Okay, so what did they find? Like, were most of these cats, even the older ones, having like terrible looking discs?
Surprisingly, no. The majority of the intervertebral discs, 84.8% to be exact, showed minimal degeneration.
Wow.
They were Pfirrmann grades 1 and 2, so that's really good news.
Okay.
Only 15.2% were graded 3 or higher. And severe degeneration, so grades 4 and 5, was really rare, even in the older cats.
That's interesting. So it seems like, aging might be connected to more IVDD.
Yeah.
But those really severe cases are not that common.
Thankfully, no.
Did they find any patterns in where in the spine this degeneration was happening?
Yes, they did. The study found that the thoracic spine, so that's the area of the back behind the ribs, had the highest chance of degeneration.
Okay.
Followed by the cervical spine, so the neck.
Right.
The lumbar IVDs, those in the lower back, showed the least degeneration.
Okay.
And this could be because of how each part of the spine moves. So, for instance, the thoracic spine rotates a lot. So that might make it more prone to IVDD.
That makes you wonder if certain activities could make IVDD worse in those areas.
Absolutely.
So they looked at all these discs on MRI, but did they also see if there were actual structural problems?
Yes.
Like the kind of disc herniations that can cause so much pain in dogs?
They did, and this is where it gets really interesting. So they found that only 0.7% of the IVDs they looked at actually had what we call disc protrusions.
Okay.
So even though a lot of these cats had some degeneration in their discs, very few had actual structural issues.
That's the burning question. Why don't we see more cats suffering from, really bad disc disease, given how common these degenerative changes seem to be?
It's so interesting. Unlike in humans, where IVD often leads to herniations and other problems, it doesn't seem to be the case with cats, or as much. More research is definitely needed.
So did they look at all into like a cat's sex and whether they'd been spayed or neutered in all of this?
Yeah, they did. And so some vets think that male cats might be more prone to IVD extrusion.
Right.
But this study didn't find a strong link between the cat's sex or whether it's been neutered and the prevalence of IVDD. It could be that they just didn't have enough intact cats in the study.
Right.
There were only 8.
Oh, wow. Okay.
So it's hard to say for sure.
So more research needed there.
Absolutely, with a larger group of cats.
Yeah, and more diverse.
Yeah.
What I found really interesting was how the prevalence of IVDD changed in different age groups.
Yeah.
So, for example, in young cats, 81.2% of their IVDs were graded Pfirrmann 1, which is essentially normal.
That's good.
Only a tiny fraction, 0.2%, had a grade 4 IVD.
Wow. That's good news for owners of young cats.
Right.
And then when you look at the middle-aged cats, 8.5% were grade 3, 1.6% were grade 4, and 0.6% were grade 5.
Wow. So you're seeing more discs with those higher Pfirrmann grades as cats get older.
Exactly.
And in the older cats, almost a third of their IVDs were graded Pfirrmann 3 or higher.
Yeah, it's a big jump.
That's a huge jump.
Yeah.
So it really highlights how aging does play a role. But even in the older cats, those extreme grade 5 discs were still quite rare.
Thankfully.
Which, again, good news. It seems like, even though degeneration increases with age, most cats aren't experiencing those extreme changes.
Exactly.
So did the researchers find differences between the age groups when they looked at specific areas of the spine?
Yes.
Like the cervical, the thoracic, the lumbar?
Yes. So, for example, in the cervical spine,
Okay.
Both the middle-aged and old cats were much more likely to have advanced IVDD compared to young cats. The difference between middle-aged and old cats in the cervical spine was pretty dramatic. Old cats were over 3 times more likely to have advanced IVDD in their necks compared to middle-aged cats.
So it sounds like as cats age, their necks might be particularly susceptible to developing more significant disc degeneration.
For sure. What about the thoracic spine? Did they see similar patterns there?
Yes. In the thoracic spine, we also see the middle-aged and old cats having much higher odds of IVDD than the young cats.
Okay.
And actually, the odds for old cats compared to middle-aged cats in the thoracic spine were even higher than in the cervical spine.
Wow.
So it suggests that the thoracic spine is highly vulnerable to age-related IVD changes.
Absolutely.
Fascinating. So what about the lumbar spine? Did they see the same trends there?
Interestingly, the lumbar spine showed a different pattern.
Okay.
They didn't see a significant difference in the prevalence of IVDD between young and middle-aged cats in the lumbar spine. So it seems like age may not matter as much in the lumbar region until cats reach that older age group.
So the lumbar spine might be more resilient to those age-related IVDD changes, at least until later in life.
It seems that way. And it reinforces this idea that different parts of the spine have different vulnerabilities.
Yeah.
And age plays a complex role in this.
For sure. So speaking of the different parts of the spine, let's get into those differences they observed between the spinal regions.
Yes.
You know, they found that the prevalence of IVDD varied significantly depending on which part of the spine they were looking at.
Right.
Especially in those older cats.
Yes.
So in the older cats, the thoracic spine had the highest odds of developing advanced IVDD.
Exactly.
Significantly more than the cervical and lumbar regions. It was striking, you know, the difference.
It was a striking difference.
Why do you think what might be driving this higher prevalence?
Well, remember, the thoracic spine has a lot of rotational movement.
Right.
The authors even mentioned a previous study that found the highest degree of spinal torsion occurred in the cranial portion of the thoracic spine in cats.
Oh, interesting. And that's the same area that showed the most IVDD in this study.
Yeah.
It really suggests that all that twisting and turning could be putting extra stress on those discs.
Exactly.
Makes them more prone to degeneration.
Yeah.
So it stands to reason that the cervical spine, which also has to move quite a bit, would be the next most affected.
Yeah.
What did they find there?
You're right. It did have the second highest odds of degeneration.
Okay.
Right after the thoracic spine. And it was also more likely to have advanced IVDD compared to the lumbar spine in those older cats.
Do you think those same rotational forces could be at play in the cervical spine?
It's possible, particularly in what we call the caudal cervical segments, which had the highest prevalence of IVDD in this study.
That makes sense. So those caudal cervical segments like C5, C6, C6, C7, those are responsible for a lot of that head movement.
Exactly.
And remember in dogs that C5, C6 is a common spot for IVDD and cervical spondylomyelopathy. Like, that's a painful condition that can cause weakness and even paralysis.
Absolutely.
So it seems like that area of the neck is vulnerable for many species.
Yeah.
Probably because of all the movement and stress it endures.
For sure. For sure.
Now, the lumbar spine in these older cats is really intriguing.
Yeah.
Because it had the lowest odds of degeneration overall.
Interesting.
And that's interesting because it's the opposite of what we see in humans, where the lumbar spine is a common site for IVD.
Right.
And this probably comes down to biomechanics, right?
Yeah.
We humans put a lot of pressure on our lower backs, you know, with our upright posture.
Yes.
But cats walk on all fours.
Exactly.
So their lumbar spines might not be experiencing those same stresses.
Precisely. Different way of moving. Right.
Yeah.
Could explain why their lumbar spines seem to be less susceptible, at least compared to us.
Right.
It's a good reminder that we need to consider those species-specific differences.
Absolutely.
You know, anatomy, biomechanics. When we're studying IVDD, different spinal regions have different vulnerabilities, and aging plays a complex role.
For sure. But now let's shift gears and talk about a really important point the study raised.
Yeah.
The relationship between seeing IVD on an MRI and actual IVD disease.
Yes, yes.
Meaning, you know, signs of a problem.
Exactly.
So just because a cat has some degeneration in their discs on an MRI doesn't mean they are having any symptoms or issues because of it.
Exactly. And this study actually found that despite a high prevalence of IVDD in these cats, actual structural problems like disc protrusion were really rare, only in 0.7% of the IVDs they looked at.
Wow.
And most of those protrusions were in the thoracic spine.
Okay.
And were found in discs with those higher Pfirrmann grades.
So even though a cat might have some degeneration in their discs, it doesn't automatically mean that they're in pain or have a debilitating condition.
And that's in contrast to what we see in humans, where IVDD is often associated with the structural failure of that disc and symptoms and problems because of it.
So that's the crux of the matter. Like, why do cats seem to tolerate IVDD better than humans?
Such a fascinating question. It could be differences in the makeup of those discs. Maybe their discs are more resilient or have a different composition that makes them less prone to herniation. Or it could be related to the way they move and distribute their weight with their flexible spines. Maybe that's protecting their discs.
Those are all really good points. And I'm curious also about the role of sex and neutering. Which we touched on earlier. So some vets believe that male cats might be more prone to IVD extrusion. But this study didn't find a link between sex or neuter status and IVDD. But they only had a very small number of intact cats, which might have, skewed the results.
True, with only 8 intact cats. It's really hard to draw conclusions about the influence of those hormones on IVDD.
We do know from research in humans that hormones can play a role in IVDD. But we need more studies. With more intact and neutered cats to really understand how this plays out in our feline patients.
Absolutely.
So this study has given us a lot to think about in terms of IVDD in cats. We've seen that, while IVDD is common, those severe cases are thankfully rare. We've also seen that the relationship between IVDD and actual IVD disease isn't as straightforward in cats as it is in humans. And we've only just scratched the surface when it comes to understanding the role of sex and neutering in IVDD.
Absolutely.
There's definitely a lot more to explore.
And one of the most interesting findings is that the areas where we see the most IVDD in this study don't necessarily line up with where clinical IVD disease seems to be occurring.
Exactly. The study authors pointed out that IVD herniations in cats, the kind that cause problems, most often occur in the thoracolumbar and lumbosacral segments. Specifically segments T13L1, L3L4, and L7S1. And those segments are further down the spine compared to where they found the highest prevalence of IVDD in this study, which was the cranial thoracic spine. Segments T1, T2 to T9, T10. So why don't we see more clinical problems from those cranial thoracic IVDs if they are so prone to degeneration?
One theory is that it could be due to a structure called the intercapital ligament in the thoracic spine.
What does that ligament do?
It's a band of tissue that runs between the heads of the ribs and helps stabilize the thoracic vertebrae.
So it acts like a brace, preventing those cranial thoracic discs from herniating.
Exactly. And this ligament is thought to be one of the reasons why we don't see as much thoracic IVD disease in dogs.
Interesting.
And could be playing a similar role in cats. Of course, this is just a hypothesis. We need more research to confirm this.
It's like a puzzle we're trying to put together. This discrepancy between how common IVDD is and where we actually see clinical disease, it just highlights how important it is to consider everything when we are evaluating a cat.
Absolutely.
For potential IVD problems. You can't just look at an MRI and see degeneration and just assume that's the problem,
Exactly.
We need to consider the location of the IVDD, the cat's clinical signs, and other factors to make an accurate diagnosis.
We need all the clues. Absolutely. Veterinary medicine is a complex field. There's always more to learn.
Always more to learn. Well, that's a great place to pause for now.
I agree. We've covered a lot of ground. But there's still more to explore.
Absolutely. Stay tuned for part 2, where we'll delve deeper into the limitations of the study and discuss what these findings mean for future research.
From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging. Welcome back to our deep dive into feline IVDD.
It's great to be back. I'm really curious to hear more about the limitations of this study. No study is perfect. And understanding those limitations really helps us put the findings into perspective.
Exactly. So one limitation the authors bring up is that they only included cats without any history of clinical signs related to IVDD.
Okay.
So all the cats in the study were asymptomatic.
Okay.
Meaning they weren't showing any symptoms of back pain or neurological issues.
So essentially they're looking at cats who, on the surface, appeared to be completely healthy.
Yeah.
At least in terms of their spines.
Exactly.
That makes you wonder, if the findings of this study would be different if they included cats who were actually having problems because of IVDD.
It's a really good point. It's possible that cats with symptomatic IVDD might have different patterns of degeneration compared to these asymptomatic cats.
Yeah.
So we have to be careful about generalizing these findings to all cats, especially those who are experiencing back pain or other issues.
That makes sense.
Yeah.
We also talked about the limited number of intact cats in the study.
Right. Only 8 out of the 60 cats were intact.
Yeah.
And this made it hard for the researchers to really draw conclusions about the role of sex hormones in IVDD.
Right. As we discussed earlier, there is a clinical impression that male cats might be more prone to disc problems.
Right.
But this study couldn't confirm or refute that.
Exactly.
So for now, that question remains unanswered. What would a study look like that could definitively answer this question?
Well, ideally, it would include a much larger group of cats with a balanced representation of intact and neutered males and females.
Yeah.
And the researchers could compare the prevalence and severity of IVDD between these different groups.
Yeah.
That would give us a much clearer picture of whether or not those sex hormones are a significant factor in feline IVDD.
Yeah. It seems like even though we've learned a lot from this study, there are still so many questions to answer.
Oh, yeah.
When it comes to IVDD in cats.
Absolutely.
It's like we're at the very beginning of this exploration.
Yeah, and there are broader challenges to studying IVDD in cats beyond the limitations of this particular study.
Yeah.
For one thing, feline IVDD is still relatively rare compared to canine IVDD.
So it can be challenging to recruit enough cats for these large-scale studies.
Exactly. And of course, we always have to think about those ethical implications of research involving animals.
Yeah.
We want to make sure we're not causing any harm or discomfort to the cats in these studies.
Of course.
Yeah.
But even with those challenges, this study is a great stepping stone.
It is.
It helps us understand the prevalence and patterns of IVDD in cats who aren't showing symptoms.
Right.
And it opens up a lot of interesting questions for future research to explore.
It does. So now I think it's time to shift our focus to how these findings might apply to our work with cats.
Okay.
In a clinical setting.
Yeah.
What do you think are some of the key takeaways for vets?
Well, I think the fact that severe IVDD was relatively uncommon even in the older cats is really reassuring.
Yeah.
It's helpful to be able to tell cat owners that, it's not a given.
Right.
That their cat will develop debilitating disc disease as they age.
I agree. It can help alleviate anxieties for those worried about their senior cats.
Right.
It doesn't mean we should completely dismiss the possibility of IVDD.
Yeah.
But it does suggest that those extreme cases aren't the norm.
Right. We still need to be watchful for any signs of, back pain or neurological issues in cats of all ages.
Exactly.
Especially in those higher risk areas.
Yes, areas like the thoracic lumbar and lumbosacral spine, where we tend to see the most clinical cases of those herniated discs.
Right.
So, if we have a cat showing weakness or pain in their back legs, IVDD should definitely be on our list of possible diagnoses.
And this study reminds us that just because we might see IVDD on an MRI, it doesn't automatically mean it's the cause of the cat's symptom.
We have to look at the whole picture.
Exactly. We need to gather all the clues.
Yes.
Including a thorough neurological exam.
Yes.
To make an accurate diagnosis.
It's like detective work.
It really is. Now, let's talk about the different regions of the spine.
Okay.
So we know that the cranial thoracic spine, that area right behind the shoulder blades, was the most likely to show degeneration in this study. But we also discussed how it's less likely to actually cause problems. Possibly because of that intercapital ligament we talked about.
Yeah.
So even if we see IVDD in that area on an MRI, it might not actually be the source of the cat's pain.
It could be what we call an incidental finding, meaning it's there, but not really causing any issues. Of course, we still need to be mindful of the caudal thoracic spine, which includes that thoracolumbar junction, because that's where we do see herniations.
Right. So if we see signs that seem to be localized to that area, we need to do further investigation.
Absolutely.
What about the cervical spine?
Well, the cervical spine had the second highest prevalence of IVDD in this study. And remember, those caudal cervical segments were particularly vulnerable, likely because of all that movement in that area.
So if a cat is showing signs of, neck pain, stiffness, or problems with their front legs, IVDD in the cervical spine should be on our radar.
Especially in older cats. They're much more likely to have more advanced degeneration in that area.
Now, what about the lumbar spine? It seems like it was the least affected by degeneration in this study.
It was.
But it's still a relatively common area for clinical IVDD in cats.
That's right. It seems it might not degenerate as easily as other parts of the spine, but it is still susceptible to herniation, especially at that lumbosacral junction.
So if a cat is experiencing, like, pain or weakness in their hind legs, we need to consider IVDD in the lumbar spine as a possibility.
Exactly.
Especially if it seems to be localized to that lumbosacral area.
The main takeaway here is that we really need to consider all these nuances when we are evaluating a cat for IVDD. The location of that degeneration, the cat's clinical signs, and other factors are all important pieces of the puzzle.
Absolutely. And this study gives us so much more to think about.
It does.
When it comes to feline IVDD. It's a reminder that, med is constantly evolving.
Absolutely.
You have to stay on top of the research so we can provide the best possible care for our feline patients.
I agree.
So before we move on to the final part of our deep dive, let's just recap what we've covered so far.
Great idea. So we've learned that, based on this study, IVDD is common in cats. But those severe cases are thankfully pretty rare. We also talked about how IVDD doesn't always equal clinical disease in cats. They seem to be much better at tolerating IVDD than us humans, but we're still not sure why. And then we explored how important it is to consider the location of that IVDD and all those other factors when we are evaluating a cat with potential back or neck problems.
That's a great summary.
Yeah.
In part 3, we'll explore what these findings mean for the future of feline IVDD research.
From vet neurojar, keep those minds inspired, hearts light, and tails wagging.
Welcome back to the final part of our deep dive into feline IVDD.
Yes!
It's amazing to think about how much we've learned about, the prevalence and patterns of IVDD in cats who aren't even showing symptoms. But what does all of this mean going forward? Like, what are the big questions that researchers still need to answer?
Well, there are so many exciting avenues to explore. One of the biggest mysteries is why cats seem to tolerate IVDD better than we do. We touched on this earlier, but we really need more research to understand the biomechanical properties of those feline intervertebral discs.
Are their discs more resilient than ours? Do they have a different composition that makes them less prone to herniation?
Exactly.
Answering those questions could really change how we think about IVDD in cats.
Absolutely. And then there's the question of genetics. Could certain breeds be predisposed to IVDD? Are there genetic markers we can look for to identify cats who are at higher risk?
Those are great questions. If we can identify those cats early on, maybe we could take steps to prevent or delay the onset of clinical problems.
Exactly. And beyond understanding the why, there's also the how. Like, how can we improve the ways we diagnose and treat IVDD in cats?
We need better diagnostic tools.
Yes.
Tests that can detect IVDD earlier and more accurately. And we need to explore new treatment options that go beyond just managing pain. Could we find ways to slow down or even reverse the degeneration?
That's the dream. I'm really excited about the potential of, minimally invasive surgical techniques and new drug therapies that could make a real difference for these cats.
It sounds like there's a lot to look forward to in terms of feline IVDD research.
Oh, absolutely.
What I've taken away from this deep dive is that, we have a much better understanding of how common IVDD is in cats. But it's also clear that there's still so much we don't know.
That's the beauty of research. It always leads to more questions.
Right.
And with every study, we gain a little more insight into the complex world of our feline companions.
It's important to emphasize, though, that even though this study focused on cats without symptoms,
right,
IVDD can be a painful and debilitating condition for those cats who do develop clinical signs.
Absolutely. We don't want to downplay the seriousness of IVDD in those cases.
Right.
You know, if you notice any changes in your cat's mobility, any signs of back or neck pain, or any neurological issues, it's really crucial to get them to a vet right away.
Early diagnosis and treatment are key to giving these cats the best possible outcome.
Exactly.
So don't hesitate to reach out to your vet.
Yes.
If you have any concern.
And don't be afraid to ask your vet about the latest research.
Yeah.
The more informed you are, the better equipped you'll be to advocate for your cat's health.
Well, this has been a fascinating deep dive into feline IVDD. We've covered a lot of ground. You know, from the study's findings to the broader implications for the future of research and veterinary care.
It has been a pleasure exploring these questions with you.
It's been a pleasure having you here. And thank you to everyone for listening. We hope you found this deep dive informative and engaging.
From Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.